Sweden has marked the last few days with 0 new COVID cases and no more than 1 death per day over the last 3 weeks, despite the country dropping the mandatory wearing of masks on July the 1st. And while fears grow about the new highly contagious Delta variant around the world, Sweden's chief epidemiologist nonetheless argues that more data is needed before any move is made against any new strains.
It is difficult to say how contagious Delta is, as when it comes to chickenpox, we have been able to follow that disease for several years. The infectivity of Delta seems to be very uneven. In some cases, one person infects 100 people. Then we have other occasions where an infected person does not infect anyone at all.
Other European countries and the US are, however, sceptical about that approach and are maintaining restrictions because of the surge in the spread of the Delta strain. Just last week, America's Centers for Disease Control and Prevention warned then that there is an urgent need, they said, for both those unvaccinated and, crucially, vaccinated to wear masks. Our guest debated the conflicting guidelines.
Sweden didn't do any mask mandates, and there's a lot of literature out there that shows that masks don't work. So if the WHO wants to let us believe in masks, then I would like to see the data that shows that makes a big difference.
Wearing a mask reduces the risk of transmitting COVID by 20%, essentially eliminates 1 in 5 opportunities to infect. Yes, it should overall reduce the transmission of the virus and might prevent, as part of the other risk reduction measures.
They told us get the vaccine and you get off the mask. Well, everyone got vaccinated and we're still wearing a mask. So I'm not really sure with respect to that, because they told us to wear the mask and then we won't have lockdowns, and now we're doing lockdowns, meaning no school or things like that. A lot of countries now are, protesting. Germany had tremendous protests, Australia had protests, France had tremendous protests. So, we got to bring the people on, because this is all about public health.
It's selfish not to wear a mask when you should be wearing a mask and when there's a chance to actually infect somebody else. We need to present powerful images and the actual voices of those we need to protect, the loved ones, the vulnerables. And the message should be focusing on protect others.
What has happened with the virus is it's already gone through the community, and those people who survived, which is the majority, now have antibodies and have herd immunity.
It's one of the risk reduction measures. We need to do several health protective behaviors. Wash our hands, wear masks, keep social distancing, and they all reduce the percentage risk. Question is, how could we persuade people who now see mask wearing as a political choice? The single biggest influence across all reasons for wearing a face mask appears